In the 1970s, psychoanalyst Samuel Dunkel proposed an unusual theory, one that has little scientific evidence to support it. He suggested that the way you sleep reflects your personality. For example, he believed that people who prefer the so-called royal sleeping position tend to be confident and self-assured, while those who sleep in a semi-fetal position are often sensitive and emotionally balanced. Although Dunkel's theory has never been convincingly proven, the way we sleep can have a real impact on our health. So, what is the best sleeping position? Over the years, sleep positions have been given countless creative names: the zombie, the mountain climber, the freefall, the soldier, and many more. But sleep experts generally simplify them into four main categories: sleeping on your left side, your right side, your stomach, or your back. For infants under 1 year of age, sleeping on their backs is recommended because it significantly reduces the risk of suffocation. As toddlers, we begin moving around much more during sleep, usually ending up on our backs or our sides. And as we grow older, our tendency to avoid sleeping on our stomachs becomes even stronger. By adulthood, side sleeping is the most common preference, while fewer people prefer sleeping on their backs, and stomach sleeping is generally the least popular. Of course, sleep habits are highly personal. Some people naturally sleep on their stomachs, while others simply can't fall asleep unless they're lying on their backs. The position we sleep in affects our bodies in several ways. Different sleeping positions change the relative placement of our internal organs, which can either relieve or worsen certain health conditions. Some positions also fail to properly support the spine, placing unnecessary strain on the surrounding muscles and connective tissues. As a result, the muscles in your back, hips, or neck may never fully relax, leaving you feeling stiff and sore when you wake up. Take stomach sleeping, for example. The least common of the four major sleep positions. It's also the one sleep experts are least likely to recommend because it tends to flatten the spine's natural curve. However, there are situations where sleeping on your stomach may actually be beneficial. For patients with certain respiratory conditions, for instance, this position allows the back portions of the lungs to expand more freely, making breathing easier. On the other hand, people with lower back pain often benefit from sleeping on their backs with a small pillow placed beneath their knees. This position helps preserve the spine's natural curves and reduces unnecessary pressure on the lower back. However, it may not be ideal for your sleeping partner, or even for you. For some people, lying on the back allows the soft tissues of the throat and the tongue to collapse into the airway. When the body tries to pull air through this narrowed passage, those tissues vibrate, producing the sound we know as snoring. This is also why people with obstructive sleep apnea are usually advised to avoid sleeping on their backs. Since this condition already involves repeated pauses in breathing during sleep, back sleeping can increase the likelihood that the airway will collapse completely, blocking airflow altogether. Today, most sleep specialists generally recommend sleeping on your side, especially with a pillow placed between your knees to help keep your spine properly aligned. But interestingly, which side you sleep on can also make a difference. For example, studies suggest that sleeping on your left side often reduces symptoms of acid reflux and heartburn. Because your stomach sits mostly on the left side of your body, this position keeps it below the esophagus, allowing gravity to naturally help prevent stomach acid from flowing back upward. However, for people with congestive heart failure, who often have an enlarged left ventricle, sleeping on the right side may help relieve pressure on the heart and improve overall sleep quality. Clearly, there isn't a one-size-fits-all answer. And trying to take advantage of the benefits of a single sleeping position isn't always easy, since most people unconsciously change positions 20 to 30 times every night. Pillows and other sleep positioning devices can help you stay in one position if needed. Fortunately, unless you have a specific medical condition, moving during sleep isn't necessarily a bad thing. It's your body's natural way of relieving pressure, responding to discomfort, and ultimately helping prevent injury. So the next time you find yourself drifting into the free fall soldier or zombie position, you can rest a little easier.